Is it possible to improve vaccine stock management in rural areas by making vaccine stock data more accessible? A project in Mozambique has been doing just that. vrMIS is a web-based logistics management information system designed to provide health workers with up-to-date information on the vaccine distribution system. This video shows how vrMIS works and how it has affected vaccine stock management in Mozambique. It asks 3 key questions about the system. 1. Why was it needed? 2. How does it work? And 3. What was the impact? Estimated worldwide immunization coverage for children has stalled at 80%. In Mozambique, poor roads, lack of transport and limited funds make reaching the final 20% particularly difficult. The lack of accurate and up-to-date information on vaccine usage and needs at the health centre level makes the problem even more challenging. Health workers at all levels can't manage what they can't see. The paper-based stock management and immunization reporting systems in Mozambique simply do not provide them with the visibility they need. Paper forms are filled out at the health centre level, aggregated at the district level, and then aggregated again at the provincial level before being passed on to the national level. Frequently delayed, incomplete or inaccurate, this system causes delays in vaccine deliveries to health centres, often resulting in stockouts and poor coverage rates. Without access to accurate and actionable data, supply chain managers are struggling. Let's take a look at how field coordinators, like FOCASH, are using vrMIS to help ensure that vaccines are available to all children, even those living in remote areas. vrMIS uses population data to help FOCASH determine how much stock to take to the 24 health centres in his delivery zone. vrMIS uses the population data, as well as information from previous deliveries, to calculate the amount of vaccines for each health centre. This information feeds into the next step, determining the total amount of stock to pick up from the warehouse. When FOCASH delivers the vaccines each month, he also collects information on vaccine stock levels, vaccine usage, equipment availability, cold chain equipment functionality, and estimated coverage rates. By doing this, he helps to decrease the administrative burden on health centre staff. He cross-checks information in the daily intake forms on the number of vaccine doses given, and then confirms that this data was aggregated correctly in the monthly forms. He corrects mistakes along the way and provides feedback and support to each health worker. He also consults cold chain monitoring records for vaccine refrigerators to identify any problems. When FOCASH completes his monthly deliveries, he returns to his office at the provincial capital and enters the data he has collected into vrMIS. Once the information is entered into vrMIS, FOCASH can generate a report for each zone, district or health centre. Here FOCASH can see how distribution went during the month. He can see if there were any stockouts of vaccines, the uptime of the cold chain, and the wastage rate of each vaccine. And based on the number of vaccines used and the estimated population, FOCASH can see the vaccination coverage rate for the province. FOCASH's supervisor, the provincial EPI manager, can use vrMIS to see how well the distribution went for the province, noting the average number of days between visits to a health centre and the number of health centres visited during distribution. With this information, FOCASH and his supervisor have an accurate picture of what's happening in the vaccine supply chain and can make evidence-based decisions on how to improve vaccine distribution. With vrMIS, information collected at the health centre level can be used by province-level decision-makers to monitor performance, assess overall vaccine distribution needs, and take measures to reduce stockouts and improve coverage rates. Health centres that were once isolated are now part of a larger network of information sharing. vrMIS has helped to reduce stockouts to just 10% of vaccines at any given time. It has improved cold chain uptime to over 95% of the time during each month, and it has increased the number of vaccines flowing through the system in over 400 health centres. vrMIS has improved logistical planning, provided better accountability mechanisms, and strengthened the capacity of the existing health system. And most importantly, with vrMIS and improved delivery logistics, an independent study in one province showed coverage rates increased from 68 to 95%, reaching children no matter where they live.